I think we've heard a lot about the future. I hope everyone has felt enlightened by what they've heard. You've heard some of my thoughts as we've gone through interspersed. I'd like to invite up Anne Blackwood, CEO of Health Enterprise East Limited, just to give a couple of her thoughts. The NHS is still a maze. HEE help people to navigate their way through the procurement layers at the NHS. So maybe if you've got a couple of thoughts, Anne, as to what you've heard today.
So thank you for the invitation to wrap up Paul. So my name is Anne Blackwood. I'm Chief Executive at Health Enterprise East, as Paul said. And we're an organisation that's known as an NHS Innovation Hub. So we have a dual remit, part of which is to provide innovation management support services to NHS organisations and their staff, helping them to commercialise intellectual property, which is found within the NHS. So NHS staff have got an idea for a new product or a new service, can come to us for advice, support and funding to help them take that idea to market. And the other side of our business is helping companies get access to the NHS market. So how do you find clinicians during the product development process and get feedback on your new technologies? How do you get access to procurement, to commissioning and to other layers of the NHS? So that you can understand how your new technology might bring benefits to the NHS. And we also provide, and have done since 2009, all the project administration behind the SBRI healthcare programmes. So we work very closely with Karen and her team in rolling out those programmes. And if anyone is interested on getting on the mailing list for the new competitions which will come out in the autumn, then do drop me a business card. So just a couple of thoughts on what we've heard today. So I think it was David Nicholson, the outgoing CEO of the NHS, who was quoted as saying the NHS organisation was so large that you could actually see it from outer space. And I think after quite an interesting and challenging kind of 2-year transitional period, we've heard from our 4 speakers today that many of the new organisations that were announced and set up over the course of those last 2 years, the CCGs, the health and wellbeing boards, the academic health science networks, are beginning to understand and grasp the challenges that they face going forward. And I think the dust is beginning to settle a little bit as we move out of that transitional period and these organisations start to get into delivery. So just a couple of sort of summarising some of the themes that have come out from the challenges that they face. So in terms of the CCGs, we heard from Howard and Rod that many of their main challenges are around providing good quality integrated care, which is person-centred, closer to home, cost-effective and transformational. We heard from Graham about the role of the health and wellbeing boards and their challenges around the ageing population, the increasing prevalence of lifestyle-related diseases, and the need, not before time I have to say, to concentrate on prevention and well-being if they're to meet the challenges, particularly around public health going forward. And finally, we heard from Karen on the role of the academic health science networks around adoption and spread of innovation, around wealth creation, and around establishing a better dialogue with industry and trying to move to more collaborative partnership with industry rather than the rather constrained customer-supply relationships that we've had in the past. So I think there's a real willingness and engagement within the NHS to kind of open the doors and recognise that, you know, as an organisation, we have been a relatively difficult marketplace in which to do business. We've been recognised as being relatively poor at adopting new technology, and I think many of these new initiatives are designed to overcome some of those barriers. So I'm going to give you my top 5 tips, which I think sort of ran through all the speeches today around what we should try to do, what you as businesses should try to do going forward. So the first is to start from a validated unmet need. And that means don't just talk to one clinician, make sure that you do your research and talk to many clinicians, particularly across different parts of the care pathway. Understand who your customer is. That may not necessarily be a CCG, it might be the provider, but the CCG, they might need to have a conversation with their commissioner, particularly if the pathway is changing. So you need to understand who's your customer, and if you are changing the pathway, you need to understand the health economics of what that new pathway will look like, because all of that needs to go in your business case. Fourth, you need to sell solutions, not products, because we, as a health service, are interested in outcomes. We know that technology is an enabler, but we want to know what the benefits are for us. So you need to sell solutions, not just products. And finally, if everything that you've heard today about the new NHS and its structures still leaves you slightly bemused and befuddled, then don't be afraid to come and ask for help. As I said, we'd like to try and open the doors. We're here to try and help, and I'm sure all of the speakers and myself very happy and willing to have a conversation with you over coffee or afterwards in the days coming. Thank you.
Excellent summary. So that's Anne Blackwood from Health Enterprise East. Thank you very much. And can I thank personally the speakers again, Howard, Karen, Graham and Rod. Thank you very much for excellent talks. And thank you to my colleagues at Matthew Arnold and Baldwin. I'm not going to embarrass anyone again, so I'm not going to mention anyone by name, but you know who you are. You've given a huge amount of help. Thank you very much for helping with this. Thank you to the Hearts LEP, to Watford Chamber of Commerce and Watford Council, the Independent Pharmacy Federation, of course, Sigma. There are feedback forms in your packs. Please, can you complete those? What sort of events would you like to see in the future? How did you find this one? Anything at all, please let us know. Don't forget your car parking codes on the way out if you've come by car. 4142, I believe. Yeah, 4142. We hope to see you on your way out. We'll be in touch. But thank you very much for coming, and I hope you've enjoyed the event. Thank you.